well. I've heard of HTV, and I'm privileged that HTV is an idea from some of our alumni in the university. It has been alluded before, innovations are welcome in the university and are greatly encouraged. I am Dr. Wasra, and I am Senior Consultant Obstetrician Gynecologist. I prefer to be called an advanced skilled birth attendant. We are saying attend the birth. Everybody who attends the birth should be skilled. Now, may I say I'm advanced because there are advanced things that I can do. In obstetrics and gynecology, we have a big problem, something called maternal death. That is death of a mother during pregnancy, labor, or after delivery, and the mother dies. This is a big issue, and we're looking at something like a Boeing 686 falling and crashing, and all the persons on board dying. So you have a number of mothers who die due to pregnancy-related issues is still high, because of complications of pregnancy and delivery, and it's a big problem for us. And we are saying a mother should not die while bringing a life to us, and it feels bad for somebody like we say an advanced skilled birth attendant, and they tell you your mother died. Of course, the causes of maternal death are several. They are different. They include postpartum hemorrhage, that is bleeding after the mother has delivered. There are issues of pregnancy hypertension, the hypertensive diseases, the infections which cause these diseases, that death. There are things that are associated with infections, and then issues of abortion. And it's not that we do not know why mothers die. We know why they die, but the issue is how can we prevent this death? Today I would like to talk about postpartum hemorrhage, because I've just had a bad experience of a mother who came and she had delivered outside, and she bled and came to us still bleeding. We tried our best, but the mother died, and I feel bad that I, Dr. Wasra, a senior consultant who has been trained, I can fail to save a mother's life for something I know what to do and how to do it. So today let me talk about postpartum hemorrhage. Postpartum hemorrhage is bleeding after the delivery of a baby up to 6 weeks after the delivery. Okay? Normally after the mother delivers, the bleeding should normally stop within a few minutes, seconds after the placenta is delivered. It should stop. But sometimes this bleeding continues. Okay? Because of where the placenta is situated in the uterus, when it comes away, that's where the bleeding comes from. This is where the baby feeds, through the placenta and the blood. So when the placenta comes out, it leaves a raw area, open vessels which can bleed. So if the uterus does not contract, the bleeding continues. Now, if there are tears in the uterus, in the delivery canal, or on the external genitalia, which we call tears, the mother will bleed from these issues, and the mother will get a problem called postpartum hemorrhage. Now, there are things that will predispose the mother to have the uterus not contracting, like for example, if she has an over-distended abdomen, a broad uterus, or for example, if she has twins, or polyhydramnios, or a big baby. Okay, it can cause the uterus to fail to contract. If it is a difficult delivery and they get tears, you get tears in the genital tract, then these ones can also bleed. Okay? Sometimes the blood fails to stop bleeding, and then this one also contribute to postpartum hemorrhage. But we know how to control bleeding after a mother delivers. But we have a problem that the mother may delay to come, may delay to reach the health unit, or the persons may not be skilled enough to control the bleeding. Of course, if a mother delivers, there are some steps we do. We give her an injection and then deliver the placenta, and then make sure the bleeding stops. If the bleeding continues, then there are steps we take. If the bladder is full, we have to empty it. We have to put up blood fluids. We give drugs called oxytocin and misoprostol, which help the uterus to contract. And then we examine to see what is causing the bleeding, to make sure there is no tear in the genital tract which would cause the bleeding. If there is a tear, then we repair that tear. But sometimes there's no tear, but the uterus contracts and then relaxes, and then you need to take other steps. Okay, you may have to take the mother to a theater and stitch the uterus or actually take it out. Okay, these are desperate conditions that you do try to save the mother's life. Of course, there are things which would go a long way to prevent postpartum hemorrhage. One of them is training. You train the people how to do a safe delivery, how to handle the mother after she has delivered, how to handle the mother who is bleeding. You do this in the trainings that you do. You do tutorials on the ward, simulations, workshops. Okay? And then there's the issue of the mother delivering with a skilled attendant. Okay? A skilled attendant is somebody who can recognize that there are problems that are happening and then take steps to prevent them. For example, if the placenta fails to come out, can that skilled attendant take the placenta out? We train them to do this. But this can only happen if the mother leaves where she is and comes to the hospital or the health unit where there's a skilled attendant. Of course, we need the mother to plan during that antenatal period. Where is she going to deliver from? How is she going to get to that place where she's going to deliver from? How is she prepared? Okay? Now, that is part of the mother's responsibility. Where she's going to deliver from, how is she going to get to that place where she's going to deliver from. And she must decide this during the antenatal period. During the antenatal period, we look at these mothers, we examine them, we make sure they are not anemic. That is little blood. If a mother has little blood, then she's likely to get a postpartum hemorrhage. Okay? And then, of course, we treat any problems that they get. Excuse me. If they have twin pregnancies, we make sure we plan how to do the deliveries. Okay, if she has been operated in one of the previous deliveries, then we prepare and decide how is she going to deliver. Well, such mothers should definitely deliver in a unit where an operation called emergency C-section can be done. Okay, because she can deliver vaginally and the uterus tears, and then that one needs an operation. Okay, so if the mother is prepared, then the hospital must be prepared to handle these emergencies. They must have the materials to use, they must have catheters, they must have the drugs, they must be skilled to handle these problems. They must have the equipment and they must have the knowledge. And of course, teamwork. Of course, there are issues like, is there blood after you've controlled the bleeding stopped, that the mother has lost a lot of blood, can you replace it? Fortunately, in Uganda, we have the Uganda Blood Transfusion Services, and these are going a long way to helping us in these issues. Of course, we need the health workers, the skilled attendants, to keep practicing these skills, of preventing and stopping postpartum hemorrhage. There's something called active management of third stage. You want every person who delivers a mother to do active management of third stage. This is a procedure where you give some drugs and then deliver the placenta, and then take steps and observe the mother serially every 15 minutes, every 30 minutes, every hour, for a period of time until you make sure the bleeding has stopped. It is important to do this and to record this. If mothers come late, then you may not be prepared. If the mother has a prolonged labor, then they are likely to get a postpartum hemorrhage. If they come to the skilled birth attendant, then you can be ready and prepared to handle this problem. Of course, there are issues. There are times the mother stays far, she delivers at home, and then the placenta fails to come out. She has delivered with a traditional birth attendant who does not know what to do with the retained placenta, and then she comes to you like this one who came with retained placenta and had bled. We managed to take out the placenta, but as we were doing the resuscitation, she passed on. We did everything that was required to do, but she arrived late. So it is important that mothers deliver with skilled birth attendants. Of course, the other things that kill mothers, the mothers delivered very many babies, the baby comes badly and you should put her stairs and we get ruptured uterus. If it ruptures when she's in the village, by the time she gets transport to come, it may be too late. Of course, when such a mother comes, the theater must be ready and we must have materials to use. And then you take her to theater and then open the abdomen and then see what is inside. Is the uterus repairable or not? If it is not, then it has to be taken out. The doctor must be skilled to do the procedure. must have the materials to use. Of course, if he's going to do the operation, he needs somebody called an anesthetist or anesthesiologist to give the mother medicines that will help him do the operation with the mother not feeling pain. Of course, there are difficulties. The mother's delay to come. She may get here and we find you already have 2 mothers who are pending to be operated, and it may take a bit of time to get to theater. But with training, planning, mentorship, supervision, we think we can reduce the issue of maternal death from postpartum hemorrhage. Of course, we address some of the other causes, but the leading cause is postpartum hemorrhage. Excuse me. We think if we have a concerted effort, we can reduce the occurrence of postpartum hemorrhage and mothers dying from this terrible condition. So we ask mothers, deliver with a skilled birth attendant, prepare for the delivery, prepare where you're going to deliver through, decide, prepare how you're going to get there, let everybody know where you're going to deliver from. When labor comes, then come. Okay? Of course, when you come, then the health workers should be ready to monitor your labor and then continue monitoring you until you deliver, and after you deliver, and monitor to make sure that they detect this complication before it goes far in starting and take steps. Of course, there are other complications that cause maternal death, but those will be handled during another day. We are saying mothers are given information during the antenatal period. Come as early as possible. When you miss 2 periods, then come, and then you start your antenatal. You'll be taken through, advised what is required of you, what you expect, and then they'll help you make your delivery plan. So we think with mothers doing their part and us doing our parts and the government doing its part, we should be able to reduce maternal death due to postpartum hemorrhage. Postpartum hemorrhage is something that kills mothers very, very quickly, and it hurts when a skilled person loses a mother. You cannot replace a mother. Children have lost a mother, husband has lost a companion, the community has lost a citizen who should be helping look after the family and the community. Women are our mothers, they are our sisters, and we should do everything to try and prevent this terrible occurrence of maternal mortality. Thank you very much. We hope all of you will be able to take something from this talk and help mothers from dying. Thank you very much. Thank you.